Hi, everyone. So we're going to get started now with our webinar. So welcome, everyone, to the Provincial Human Services and Justice Coordinating Committee webinar on cannabis. My name is Tasha Rennie, and I am the Network Engagement and Communications Officer for the HSJCC Secretariat, and I'm going to be moderating the presentation today. Thank you so much for joining us today. Our presentation today is going to be focusing on cannabis and mental health. This is the first in a series of webinars exploring topics related to cannabis legalization. The impacts of the upcoming legalization is an area of great interest to our membership and presents a lot of different opportunities and avenues for exploration moving forward. So mental health is the focus of today's presentation, but we're very interested in hearing from our membership about other topics you would like to explore as we move forward with this legislation. So please feel free to provide any feedback through questions or through our evaluation survey at the end of the presentation on issues you're interested in exploring as we move forward with this. Before we get started, just wanted to let you know a few things about our webinar today. We'll have a Q&A period at the end of the presentation. If you want to ask any questions, just type it into the chat box on the side of your screen. We have a lot of people joining us today for this presentation, so it might be difficult to get to all of the questions, but we'll do our best. And we still encourage you to type in any questions that you have, as it will give us some valuable feedback in terms of future presentations. This webinar will be recorded, so the recording will be made available to all of our participants, as well as the PowerPoint presentation slides. And you can also find all of our webinars on our website for HSJCC. And again, we'll be sending out a brief evaluation survey at the end of this presentation. So please fill that out, as it will help us plan for our future webinars. And for anyone joining us today who isn't aware, the HSJCC network is made up of 39 local committees, 14 regional committees, and 1 provincial table. Each HSJCC is a voluntary collaboration between health and social service organizations, community mental health and addictions organizations, and partners from the justice sector. Our presenter today is April Trewhitt of Canadian Mental Health Association, Toronto, and April is registered psychotherapist and agency lead for addictions. So with that, I'm going to pass it over to April.
Thanks so much, Tasha. I hope that the volume is okay. So I just wanted to start off by saying, I think we're all aware that cannabis has definitely been in the news as of late. It's such an interesting topic. And the presentation I'm doing today sort of came out of a colleague of mine who's a family worker, and myself looked at a lot of evidence, looked at a lot of research studies, sort of spoke with other service providers, and put together a workshop for our staff, and then also put together a workshop for parents who were supporting a loved one that was using cannabis. And these workshops, on average, were about 3 hours. So I've condensed some of the information. My hope is that you will get some questions answered, and I imagine that this presentation might leave you with some more questions. I mean, I was thinking about this last night, and the funny thing is, I think in the last 3 months, especially, I have family that live in the U.S. and they've sort of been consumed by stuff that's happening with Trump, and I have been glued to find out, what's happening in terms of cannabis. As you know, in Ontario, we have a new government, so they've made some big changes. But what we'll do right now is we will talk a little bit about cannabis. I'm gonna review some of the research and some of the information that we know around cannabis and psychosis. I'm going to touch a little bit on cannabis and brain development. And then we're going to have a sort of conversation, or I'm going to touch upon some of the considerations with legalization as sort of service providers. So to make it a little bit fun, we sort of do this cannabis Jeopardy. So, does anyone, a lot of clients that I work with talk about using poppers. And I imagine that some of you know what a popper is, but for those that don't, a popper is when someone takes a bong and sort of stuffs it with tobacco and then sprinkles some cannabis on top and then lights it, and the cannabis actually makes this popping sound. It's not a popper from 20 years ago, which was to do with a different substance. And the reason why I put popper in this presentation was I think one of the things as service providers is that we should sort of know the language and know what clients or people are using. Another one is, I'm not sure if anyone knows what cannabinoid hyperemesis syndrome is. And this is a syndrome that sort of came out of clinicians recognizing a common cluster of symptoms in a relatively small population of chronic, heavy, and regular cannabis users. And what it is actually it's a syndrome where some people who are chronic, heavy, and regular cannabis users feel really intense nausea in the morning. They have an increase in nausea or an increase in vomiting, and what gets rid of that nausea is not a cold bath or cold compresses like someone would think. It would be a hot bath or hot shower, really having a lot of fluid, or smoking a joint, smoking or consuming cannabis. So it's a really interesting sort of syndrome to kind of pay attention to. And then what is indica and what is sativa? So indica is a strain, and we know that there are hybrid strains. So a hybrid would be a combination of indica and sativa. But indica is a strain of cannabis that has a lower THC. So there's some discussion that it's better for nighttime. It's known for its relaxation properties. It works on the dopamine system, and it's got short leaves. And it can help with nausea, acute pain, and it stimulates appetites. Whereas sativa is a strain of cannabis that people report better for daytime. It's known for that more creative, psychoactive high. It's a taller plant. It grows outside. It's got a lower CBD, and we're going to talk a lot about sort of THC and CBD during this presentation. And sativa is known to have an anti-anxiety or antidepressant effect, and sativa is really good for chronic pain as opposed to indica, which has been known to sort of treat acute pain. And then this is probably one of the more fun ones, like what are some examples of edibles? So, edibles, I think, is a really interesting market, and we know that a lot of the provinces have indicated that they need some more time with the edible market. So in the province of Ontario, edibles will not be available as of October 17th. They will be available sometime in 2019. Colorado had an interesting experience with edibles. As the pictures sort of depict, in Colorado, you can get cotton candy with cannabis, chocolate gummy bears, cough drops, energy drinks with cannabis. So there's been a lot of discussion about what this market is going to look like in the provinces, and the federal government has sort of really kind of indicated that they want to be really cautious around the edible market. Some of the lessons learned from the tobacco industry was that we really want to be mindful of not targeting candy-like products or products aimed at a younger demographic. As this is an age group that the government is concerned about, and we know that in terms of a harm reduction framework, edibles, you're not combusting it, so they can have less of an impact on the cardiovascular system. And we also know that, when people consume edibles, that it's got a delayed onset of when you're feeling the psychoactive effects. So it's going to be really interesting to sort of see next year how the provinces deal with the edible market. I don't know, for people that I work with, the dispensaries in the local Toronto area are not allowed to sell edibles, but there are a number of dispensaries that do. But it's really sort of it's word of mouth. Oops, I went too fast there. So this is the other interesting area, I think, in terms of when we look at cannabis legalization. There's so many different products available. So one of the products I put is a calm spray. So this calm spray is a CBD spray. So it's got no THC, so it's got no psychoactive properties to it. And this spray is available in not just in dispensaries. This one is available in it's not a Shoppers, but it's a local pharmacy. And people report that it's got an anti-anxiety effect. And then the other picture is a vape. So it's liquid marijuana. So it's and clients that I work with, talk about how how they sort of are transitioning in terms of using vaping or liquid marijuana, or they call it concentrate. So this is definitely another product that people as service providers we should sort of be aware of. I mean, it's like the e-cigarettes. It'll be interesting in terms of, what happens in sort of in the vaping market. This is a really strong market that's gaining some traction. We know that in tobacco that the vaping market in tobacco has seen increases, and I imagine it will be the same for cannabis. So when we're talking about legalization, I think what comes up for staff and what comes up for parents and when I'm talking to people outside of my work environment, really what comes up is around, what about the mental health effects of cannabis. So we're going to talk a little bit about sort of mental health and cannabis right now. So when my colleague and I, Julie, did a review of some of the literature, and there's a lot of literature, and of course, I think this literature review it sort of brought up a lot more questions. But what we know so far is that about 1 in 13 people will experience psychosis. So that's about 7.5% of people. And then out of those, out of the people that experience psychosis, and this is people that are experiencing psychosis and actually receive treatment for psychosis, so people that access the mental health system. So we know that number probably is higher, as only a certain percentage of people are going to access the mental health system for psychosis. And then we know that 1 in 100 people will receive a diagnosis of schizophrenia. So it's about 1%. And then when we look at the research, and we'll talk about some of the factors that impact this research, some of the studies that have been done, and then some of the challenges around the study. So it looks like for people who use cannabis regularly, and when we talk about regularly, we are talking about people who are consuming cannabis on a daily basis. They're saying about 1 in 50 will receive a diagnosis of schizophrenia. So it's about 2%. So when we look at cannabis and psychosis, a lot of the research talks about, and there's a strong association, and there's not, and we can't prove that early experiences of cannabis use cause psychosis, but we definitely know that there are a number of studies that have looked at an increase in psychosis with cannabis use. Some studies have found that, and we know that other studies have not been able to replicate that. And then we also know that there's a lot of variables in this piece. I mean, it's one of the studies looked at cannabis that had a higher THC content. And just as a reminder, sort of THC is a psychoactive property in the cannabis plant. So THC, CBD, and there's a number of other things in cannabis that all sort of interact. But THC is the psychoactive property. So there were studies that have shown that a higher THC cannabis was associated with a greater risk of a psychotic episode than a lower THC cannabis. So sometimes a lower THC cannabis is called like a hashish cannabis. So this is an area that might be really helpful as the research looks at the different strains of cannabis. And then when we look at the different strains of cannabis, we look at what might be some of the different risks. So this is an area of interest in terms of, right now a lot of the research hasn't been able to distinguish in terms of, the impact of different strains on psychosis because it's been an illegal substance. A lot of the research has relied on self-reports. One of the benefits, I think, of legalization is that, legalization allows for sort of a cleaner product in terms of the research aspect of it. But right now, results from research studies have been quite varied, and the studies have been flawed. There's been some real challenges in terms of replicating some of the studies. And then when we look at cannabis and psychosis, we know that there's, cannabis use. So what draws people to use cannabis is a unique experience. And then when we look at people who are experimental users versus chronic users, there's sort of differences in there. And then when we look at, people who experience psychosis, it's also a really varied experience. So when we put those together, it's really difficult to sort of tease out what impacts what. So there is some discussion of this reverse causation effect. So could it be that the experiences of that early internal experiences, of psychosis, or early internal experiences that lead to psychosis might actually cause someone to be more likely to use cannabis. So that's one of the theories. And then, as I mentioned before, there's a lot of sort of discussion around, cannabis that has a higher THC content, cannabis that might have a higher CBD content. I mean, one of the interesting things that we sort of came across is that in the EU right now, they are actually using CBD as a treatment for psychosis. So they're looking at, cannabis with a really low THC content and a much higher CBD content as a treatment for psychosis. And then there's, like anything, there's a lot of other factors. So genetics is definitely one of the factors. We know that. There's been some studies that found cannabis to have a stronger effect on the risk of people getting a diagnosis of schizophrenia in people with a specific gene mutations. There's some discussion that if people might have schizophrenia as part of their family history, it might be an additional risk factor. It's not a cause, but there definitely might be a risk factor in terms of that piece. But again, researchers haven't been able to really replicate the results. Another significant factor in the literature is around childhood trauma. And when I talk about childhood trauma, the research really looks at trauma in the form of abuse, neglect, bullying, loss, and et cetera. So there's been 3 studies that have looked at the presence of childhood trauma and cannabis use actually increases the absolute risk of psychosis to a greater degree than the sum of either risk factor alone. So is trauma such an important factor when we look at the connection between cannabis use, psychosis? So my colleague and I thought that was a really interesting finding. We do know that cannabis does have an impact on psychosis. We know that high THC cannabis has an impact on psychosis, but there's so many sort of other factors that sort of are part of this story. I think the other thing when we look at the impact of cannabis and psychosis and it's it's in the sort of literature around cannabis and brain development is there's a lot of research that's looking at does age have an impact? So there's been some research that shows that for people that start using cannabis earlier, so there's some discussion that 14, 15, 16, that people who are starting to use cannabis more regularly at an earlier age tend to, like other substances, in terms of their tolerance effect, tend to become more chronic users. And does that have an impact? So we know that one of the factors when we look at cannabis and psychosis is around this sort of a small percentage of cannabis users being more chronic users, and that a large percentage of the harms around cannabis use is in a small percentage of cannabis users that are using more chronically, and there's some discussion that age might have an impact. So it's not, there's nothing sort of set in stone. Some studies show that it's 14, 15 that tend to have an impact, and there's some studies that show it's a little bit later, and then there's some studies show that age of onset actually there's no difference in terms of when someone started. But I think this is definitely an area of concern. We also know that when we look at cannabis and brain development, we know that the brain isn't fully developed until your mid-20s, and that early adolescence is a really sensitive time period for brain development. And then when we look at the impacts of cannabis use, we know that there is an association between persistent cannabis use. When we look in adolescence, when we look at someone's IQ, when we look at like the impacts on learning, when we look at the impacts on memory, when we look at the impacts on executive function. So this is a really interesting area. I think that we're going to know a lot more as legalization happens, and as there's definitely a lot of interest in terms of this piece. I mean, we also know that this period in brain development in the adolescent time period is also when the endocannabinoid system is really developing. So that might also have an impact in terms of the impacts of early cannabis use and brain development. And then we have some questions. I mean, we have some questions around, are some of these changes reversible? There is some evidence that there might be some structural changes in the gray matter or white matter for people that are using, cannabis in a chronic fashion prior to age 17. But still, there's a lot that we need to sort of tease out. So we know, there's definitely some themes here. We know that, cannabis is not a benign substance. like tobacco, like alcohol. And I think one of the challenges with cannabis is that unlike alcohol, it's got medicinal properties, as well as like a psychoactive recreational impact. So, what are some of the things we don't know when we look at cannabis and mental health? So we don't know what is the impact on the brain. So I think, because cannabis, we know there's so many different strains of cannabis. We know that people, a lot of the studies have relied on people's self-reports, and we know that we can assume that people are underreporting their use. So it would be really helpful as we move forward to have research studies where we can actually look at, what are the impacts of cannabis that has a higher THC content? What are the impacts of cannabis with a higher CBD content? Like I mentioned before, the study in Europe that's treating psychosis with cannabis that has a higher CBD content is one of the pieces that has emerged in the last number of years is that we know that CBD has got some really helpful and protective factors. So one of the changes in cannabis in the last 10, 15 years is that some of the cannabis that people are buying from the illegal market has been grown so that it has a higher THC content and a lower CBD content. So there's been some myths around how much stronger is cannabis now as opposed to 10, 15, 20 years ago. And really what it looks like what the research is saying is that producers have actually been sort of weeding out the CBD, and there's a lot of discussion that the CBD is really helpful. So one of the benefits of legalization is that when people are buying product, through where they're going to buy it. So in Ontario, it's going to be the Ontario Cannabis Store, and in the private resale market, we're going to know that the quality of the product is going to be higher quality, and we're going to know that it's not going to have a really low threshold of CBD. So that'll be really interesting. What we don't know when we look at cannabis and brain development is, was there impairment of brain function before the cannabis use? So like when we look at cannabis and mental health, are people drawn to, impacts of a brain injury or impacts of a developmental issue, or was there some impairment of brain function that may have, caused someone to sort of turn to cannabis use, as opposed to cannabis use causing the impairment of brain function? Some of the research has looked at, does education have an impact on the brain's function? There's been some studies that have looked at, that young people who are using cannabis, might be struggling in school. So is that an impact of, chronic cannabis use and the impacts on memory and learning, or, was this present before and it's just being exacerbated by the cannabis use? And then, what does it actually look like? How much does someone have to use? At what age? What age does it matter? At what type of cannabis are they using? And then the really important question, is it reversible? So, what are the real risks of cannabis use on the brain development, and how do we talk about those risks in a meaningful way with younger people? So in terms of what we know in terms of cannabis and psychosis, we know that for people who are chronic cannabis users, the research right now has shown that for people that are chronic cannabis users, about 2% will receive a diagnosis of schizophrenia, as opposed to 1% of people who will receive a diagnosis of schizophrenia who are not using cannabis. So it's about a twofold increase. And we know that the association, again, is only seen in heavy and regular cannabis users. So when service providers are looking at engaging with people, I think one of the take-home messages is to really have a good understanding of what does someone's cannabis use look like? Is this person, a chronic heavy user, and might they be then at greater risk than people that are recreational or occasional users? And then we know that sometimes we see more impacts in people who start early. And then we know that, like other drugs, that rates of cannabis use among youth have sort of dipped and increased and dipped again. We know that, cannabis is a substance that is highly used among youth. And again, we know that THC levels have really changed over the past few decades, and yet the rates of psychosis and schizophrenia, for the most part, have remained relatively stable or the same. And then, like I mentioned before, there's so many other factors to consider in why someone may use cannabis and why someone may experience psychosis. So it's a really complex puzzle that we've got some answers to, and we've got an idea of where some of the pieces fit together, and then I think we've also got a lot more questions. And then when we look at cannabis as this substance, so I think, like I mentioned before, cannabis is a really interesting substance because it's got this medicinal property, and it's got a long history of recreational use. And we know that there was cannabis can really be polarized, and we see that in some of the discussions around legalization. So there have been time periods where cannabis has been demonized. There's some cultural impacts around the sort of demonization of cannabis, and then we also know that cannabis can be really romanticized. So I think the pendulum has swung, and where is sort of the middle ground? Where is the middle ground between knowing that for some people cannabis use might be really harmful, and for others they might be able to use it with a lot less harms. And we know that, what's unique about cannabis is that it really, has some medicinal benefits for physical health issues, cancer, MS, IBS, pain management. Like I said, CBD for psychosis. There's some antidepressant, anti-anxiety effects, depending on the CBD THC component. And that, we've because tobacco and alcohol have been so normalized, people are really sort of seeing cannabis maybe a little bit differently. And will legalization allow cannabis to be a little bit more normalized? And we have a lot of discussions at my agency, when we're looking at sort of cannabis, how are we able to not get caught in the polar opposites of romanticizing it and demonizing it, and how ineffective it is as a service provider to become polarized. How as service providers, it's I think it's most helpful when we have a really good understanding of some of the risks and benefits of cannabis, and we can have sort of open and meaningful conversations. And we know that it's like any drug, it involves risk, right? And that saying cannabis might be helpful for some people is not to deny it might make others worse. And another discussion is, when we look at sort of some of the medications, treating different symptoms, like long-term antipsychotic medication can be really helpful for many, and it also has, it can also have a pretty significant side effect profile. And how does that compare in terms of long-term use of cannabis use? I do a lot of consultations with our early intervention program, and a lot of the clientele talk about talk about some of the real beneficial effects of their use of cannabis on mood, sleep, appetite, etc. So again, being able to have a more fruitful discussion about, what's helpful about it and what's not helpful, how does it compare to like the options, the sort of treatment options that are available. So I just wanted to talk a little bit about a case study. And I think this is just to kind of highlight this sort of interesting position we are in terms of legalization. I was working with a young person who was under the age of 25. I was doing some consultation with one of our teams around the addiction piece. And so this person receives mental health and addiction services. They had a diagnosis of schizophrenia. They had a sort of history of cannabis use. They definitely had an early onset, started, smoking pot 14, 15, and also was a really heavy tobacco user. Had some, minor criminal justice involvement, lived at home, and really, was sort of at risk for criminal justice involvement when their mental health symptoms were more active or were more present. And they were working with a provider who who is really open to sort of having discussions around, the role, looking at antipsychotic medication, other medications, and looking at cannabis. So this provider, they had tried this individual on some different types of antipsychotic medications with minimal results. And the client was feeling really frustrated and still was using cannabis. And, there was a lot of discussion that sort of cannabis, might be contributing in a negative way to some of the psychotic symptoms. So the prescriber and this client sort of made an agreement that, the provider would, they would try, I put in quotes, because it couldn't legally prescribe cannabis in this circumstance, but the addictions medicine doctor said, let's try. So they looked at where this person bought their weed. It was a dispensary, and they looked at finding a weed that had a little bit of a lower THC content, a higher CBD content, and then they discussed what would be the frequency of the cannabis use, how they would measure the impacts on symptoms, and the client was like, no, I'm going to agree to use less cannabis. And the reason I say is, so, they sort of tried that piece, and, even a lower THC cannabis, this person was still exhibiting some symptoms. And so then they came back to the table and looked at some other treatment options. And the reason I bring this up is I think it was a really nice example of how legalization is going to sort of open up some opportunities, to look at how do we better support people. So this client, was open to trying a lower cannabis, like a lower THC cannabis, and it really actually solidified this relationship with one of our prescribers in a way that I thought was really interesting. So I'm not going to go into this. I think, it's just a reminder that when we look at cannabis use, we want to remember that, the substance use continuum, that people can kind of, go, in these areas, like go from dependent use to regular use. People can go from experimental use to regular use. And we're looking at, what are some of the drivers in terms of that piece, and that substance use is not a static phenomena. So cannabis, we know that cannabis, the U.S. and Canada, cannabis is a widely used substance. Canada has one of the highest rates of cannabis use in the world, right? We've got a province, British Columbia, that is known for their cannabis product, and we know that that it's a huge market. So I was just looking at some stats, and in Colorado from 2015 to 2017, there was some discussion that the legal cannabis market was about 230 million, and there's some discussion that depending on the province you live, that cannabis is is going to be even greater than 230 million for some provinces, because it's such a widely used substance. And we know that one of the drivers of legalization was the impacts on the justice system. We know that the impacts on the justice system for cannabis for simple possession were pretty significant, and that when we looked at the impacts of criminalization and used an equity lens, we knew that some of the people that were most impacted were people that were marginalized or racialized. And then when we look at sort of cannabis legalization, we really want to know, as providers, the differences between legalization and decriminalization. So again, we know that there are a number of places that have decriminalization, and one of the ones that comes to mind is Portugal, who has decriminalization of all substances. But decriminalization and legalization are different, right? Legalization is sort of more of a bigger umbrella, and it's really applying a health harm reduction policy, and looking at regulation and many other things other than just sort of the criminal penalty sanctions aspect. And so this, I should have said in Ontario, but in Ontario we know that legalization is being discussed in our legislative assembly daily. Our previous government originally was gonna just have something like the LCBO. They were calling it the Ontario Cannabis Store. But with our new government, they have increased access. So they've said that as of October 17th in the province of Ontario, it's going to be available online. So you're going to be able to purchase dried leaves, cannabis oil, and seed online. People are going to be able to grow, a certain number of plants, and that from October until April of next year in Ontario, it's only going to be online. And then in April 2019, we're going to get a lot more information about what does the private retail market look like. And we know that the federal government spent a lot of time sort of looking at, and then the provinces have spent a lot of time looking at, access as a key issue. So, what does the point of sale look like? We know that access is a pretty significant factor in terms of a contraband market or an illegal market. There was a study earlier this week that from the University of Waterloo that said that there was going to be a shortfall of supply in the range of 30 to 60% in Ontario. And the government has said that no, they don't believe that it's going to be that high. But this is so one of the key pieces around legalization was to really kind of pull cannabis out of the illegal market and bring it into the legal market, right, where we can regulate it. People know the level of THC, the level of CBD, and this is going to be one of the challenges. So as October 17th comes, having an online platform might be really beneficial for some, and then it raises some other concerns around privacy and around, whether the sort of illegal market is still really going to flourish. I think, the other, and we've learned a lot from tobacco. So really, there's going to be a strong emphasis on, looking at the price and dissuading it from the contraband illegal market. And Washington, when we look at Washington and Colorado, we know that with legalization, there was a slight increase in people reporting, their use of cannabis. So there was a slight increase in use of cannabis, and then it kind of dipped. And then earlier this week, there's been some discussion that it's sort of rising again. And we know that substance use is not static. It's sort of a fluid experience. And we know that in Colorado that they saw an increase in hospital admissions following legalization. And in Colorado, I don't know if I mentioned, they have really sort of branded themselves as like a tourist place for cannabis, and they have a really strong, edible market, and some of the experiences was around the edible market. So they learned a lot that there was, that some of the THC and CBD in the edible products that were being sold was too much, that the dose was too much in a single serving. So they made some changes in that piece. And Colorado has 3 policies, and we're looking at, what does that look like here? So Colorado's got a recreational cannabis policy, a hemp policy, and a medical policy. So there's some discussion in terms of what's that gonna look like for provinces. And then the other big area I think that comes up is around driving. There's we know that cannabis, unlike alcohol, stays in the system in a different way. For people that are in Ontario or in Toronto Police Services and this is another interesting area I think around the employers. So there's been some discussion about, what does it look like for people in police services or in emergency services or in justice services? What does it look like? What are our policies, in terms of the employer piece look like around legalization? And again, how do we look at, making accommodations for medical use versus recreational use? And how do we minimize risk and how do we, maximize benefits? So I think this is an area that's where people are struggling with. And I know that there's been some discussion around in Ontario about what's the role of cannabis dispensaries. So pre-legalization, a lot of clients were getting their cannabis from dispensaries, and under the current setup in Ontario, dispensaries will not be allowed to sell cannabis as of yet. And a number of clients of mine, that's where they go. So what's that going to look like? So legalization in Canada, I think there's some tensions. I think there's a lot of concerns around young people. So we know that the federal government, when they released a report where they went throughout they went throughout the country and talked to different stakeholders, and one of the big worries was around this youth market. Like, how do we really be mindful of the impact of legalization on the youth market? So there's a lot of sort of tensions in that piece. I think some of the stuff I was reading before, some of the stuff that I was reading has really highlighted that as service providers, we'll really need to manage harms from cannabis use and also be able to detect signs of misuse. So I think a lot of service providers feel a little bit ill-equipped around navigating, what are some signs of misuse? How do we manage harms in an effective way? I think I mentioned at the beginning, I think, providers will really have to know the different cannabis products that are available, and how does that what's the harm profile from different products? We know that we've got a cannabis lower risk guidelines. We know that, people are playing catch up. There's been I was looking at all the sort of different resources that were available in the last month, and I was kind of astounded. In Ontario, our Early Psychosis Network has recently released a resource for young people. We know that in Ontario there's going to be an influx of ads as of next week talking about some of the risks of cannabis use with a special focus on the youth market. I don't know if people have heard of this. So it's, a lot of clients of mine that sort of use this weed maps piece. So it has discussions about, different strains of cannabis and, where you can find this, where you can find that, what's helpful, what's not. I'm sort of rushing at the end. I think Canada, we're in a good place in terms of, we've got the experiences of the U.S. And we know that a number of states. I think right now 8 states in the U.S. cannabis is legalized. We have some data from states where it's been legalized and some of those experiences. We also know that in Holland it's been legalized. So we do have a framework to sort of go, to sort of use, and then we've got a lot of other factors, and I think cannabis and mental health and cannabis and brain development are 2 areas of a lot of interest in the research community around this huge umbrella of cannabis legalization. So I'm just being mindful of the time. So I don't know if people have questions.
Thanks, April. So we do have a bit of time for questions. So if anyone has any questions, feel free to type them into the chat box, and we will try to get to as many as we can. Just a reminder, the slides from this presentation will be available on the website, as well as a link to a recording of the webinar. So we'll be sending that out to all of the participants afterwards. So while we're seeing if anyone has any questions, I was wondering, April, you did touch on some considerations for service providers, which I thought was really wonderful. A lot of our membership works in the mental health, addictions, and justice sector. So I was just wondering if you were aware of any best practices in terms of how organizations are approaching this change.
Yeah, that's actually a great question. That's so. I mean, I know that some people in the mental health and addiction sector in Ontario, and I can actually send. So on the PowerPoint there is a list of some of the research that my colleague and I looked at in terms of putting together this presentation. But there are some best practices looking at different populations that I can attach. Tasha, I can send to you after. I think colleagues in the mental health and addiction sector in Ontario, a lot of discussion around best practices has been to make sure that to look at the sort of the role of the employer in terms of this piece around staffing and cannabis use, and then there's been a lot of discussion around what are some best practices around this with clients that we serve. So my agency, we've been discussing it with some other housing providers around what does this look like in terms of clients of ours that are living in housing that is managed by my agency or housing that's managed by other mental health and addiction service providers. So there are some tensions in terms of the Residential Tenancies Act. So how do we and there's been a lot of discussion about how do we educate our service users, and how do we have more meaningful conversations? I mean, what I'd be interested to see, you bring up a good point, is I actually haven't seen if there's any toolkits it would be really great to have an organizational toolkit in terms of, implementing a sort of cannabis policy or et cetera. That I haven't seen. I don't know if that answers your question, Tasha.
It does, yes. Thank you.
Okay.
Excellent. Okay, so I'm just looking through some more questions here. Give me one moment. So a number of people are asking just for more information in general about CBD oil.
Sure.
So would you mind talking a little bit more about that in terms of, I guess, some of the benefits and uses?
Yeah, sure.
Also,
So,
yeah.
yeah,
Go ahead.
definitely. So this is an area that I recognize that I actually have to know a little bit more about too. So, and I should have mentioned. Sorry, I had this in my notes, and I don't think I mentioned it. CBD oil is a really emerging area as well. We know that. So there's sort of CBD oil that has THC in it, and then there's CBD oil that only has CBD in it. So when we look at what the treatment implications are, so for people that are looking at treating chronic pain, you would be looking at a CBD oil that had you'd be looking at a cannabis oil that had a higher CBD and a lower THC, but it would have to have some THC. So right now, legally, that will be available as of October 17th. And then there is CBD oil, like in the picture in my presentation, that's just CBD that you can find at like a local pharmacy, and that's more of a anti-anxiety thing that you sort of spray in your mouth. So so my mother's in the baby boom generation. She's in her early 70s, and it's interesting. So we've been chatting about how her demographic has really been using CBD oil as an effective pain management strategy, and we know that I think it was just trying to find this in my notes, but I think there was when we look at CBD oil, there was some research that looked at right now for people that are treating chronic pain. That's right. That 1/3 of people who are treating chronic pain and taking prescription painkillers report that feeling so unsatisfied with the benefits or the result of a prescription painkiller, and that this is really a sort of an emerging market in terms of the using a CBD oil as an effective pain management strategy.
Wonderful, thank you for that. And there was another question about whether CBD oil will test positive in urine screens.
Yeah, that's a great question. So I'm not 100% sure. I think it would depend on the THC content, but that's a great question. I'm not sure. That's something I can definitely look into.
Great.
I imagine if there's some THC, that it would, especially if someone's using it for pain management as opposed to like an anti-anxiety effect. But there's, this is sort of a sort of contentious issue too. I mean, Colorado had a lot of difficulty in terms of driving regulations and legalization. Mm-hmm. So yeah, we're still on, there still is some discussion around what might be the most effective drug test to sort of test impairment. And there was a study out earlier this week that reported that, this is an area of big concern, that there's a large percentage of people who report, driving in a vehicle, in less than 2 hours after consuming cannabis, and that also people who are passengers were in a vehicle with someone who had consumed cannabis. So I think there's going to be a lot of education and awareness around this piece.
Yeah. Yeah, that's really interesting. I think we have time for one more question. So I was wondering if there's any consensus in terms of what is the safest way to consume cannabis.
Yeah, great question. There is some consensus that, the Center for Addiction and Mental Health in Ontario with some other service providers did have some discussion around, they contributed to these cannabis lower risk guidelines, and I can send a link for that. So, yeah, definitely they're saying that, no risk is no use. But there is discussion again that non-combusting it, so vaping would be safer than smoking it, and then what might be safer than vaping it would be eating it. And then again, that there are some impacts with sort of with the delayed onset of effects from eating it. I mean, vaping, it's really interesting. We saw this with e-cigarettes, that really making sure that we have high quality vaping products, right? Otherwise, people are going to get a higher concentration of cannabis in a vape pen, unless it's a high quality vape pen. This is definitely an emerging market as well.
Mm-hmm.
I think that just the other thing that I sort of say when we talk about cannabis is, we know that, the sort of government is this is obviously going to bring in some revenue for the government. And, there's been a lot of discussion, even in terms of the stock market piece, right? That cannabis is investing in cannabis the way to make a cool couple of a cool couple million or something like that.
Yeah. No, I mean, it's right. You're right. There's so many areas for consideration and unknowns. It's really a very fascinating subject to be talking about right now.
Exactly.
Yeah, well, I think unfortunately that is all the time that we have for today. I really wanted to thank you, April, for joining us today. That was a really wonderful presentation. And thanks to everyone for signing on to the webinar today. So again, we'll be sending out all the presentation details afterwards. And thanks again. Have a wonderful day, everyone.
Thanks, everyone.